Hello friends, I am Dr. Sandeep Bhasin from Carewell Medical Centers. Have you undergone hair transplant or are you planning for hair transplantation and you're worried how to maintain the results of hair transplantation for a long time and keep the density of hair good? To know the answers of this, please watch on this telecast on how to maintain good results in hair transplantation of the hair after hair transplantation. So I'll be sharing it with you all the tips regarding this. Now, number one, what we have to understand before you go for hair transplantation, you must understand what is the cause for your hair loss. You know, the commonest cause for hair loss in males is alopecia androgenita, which is because of dihydrotestosterone hormone. Now, in this condition, hair transplant is the gold standard treatment along with minoxidil and DHT blockers. But there are other causes for hair loss also, like telogen effluvium, scarring alopecia, alopecia areata, and other causes also. And if there are other causes for hair loss, the transplant may not be the ideal solution for them and the results may not be that good as we can get for alopecia androgenita. So before you are planning for hair transplantation, please check that what is the cause for your hair loss. Is it alopecia androgenita? Is it some other cause? If it is alopecia androgenita, hair transplant is a good solution, but not for other conditions. So first is make the right diagnosis. Now second, when you're planning for hair transplantation, my dictum is hair transplant does not stop hair fall. What you have to understand, hair transplantation is a surgery. It can implant hairs, transplant hair from the donor area to the recipient area. It will not stop the hair from falling because there are many factors. Some factors are in the hair, some factors are in the scalp, some in the genes, some in the hormones, which are promoting hair loss. So transplant is a surgery. It cannot change the structure of your hair. It cannot change the chemistry of your blood, your hormone status, your receptor status. That cannot be changed. So transplant by itself will not stop the hair fall. What it can do and what it can be effective is because we take graft from the back of the head, which have comparatively hair which are hormone resistant. So we say that the results can the hair that can last longer than the native hair. But with time, these hair also, when we transplant from the donor area, from the back to the front in the recipient area, they can also become hormone sensitive and they can also be lost with time and as the time goes by. So what is important is take care of your hair after hair transplant. Anyhow, the native hair that we have not transplanted, you can lose them, because that nothing can, unless you're taking medications like minoxidil and DHT blocker, you cannot stop the loss of the native hair. So using proper medications and lifestyle post hair transplant is very important. If you are not doing that, the result may not last very long. This is something you should understand, keep in mind. Otherwise, what will happen 2 years, 3 years down the line, you will not be very happy with the result. Maybe your transplanted hair are there, but your native hair has been lost. So you reach to the state level where you were 3 years back only, and you will require another hair transplant, which is not a good thing. So take care of your hair, take proper medications, take care of your lifestyle to prevent this. Okay. Now coming to, when you understood this thing basic, what we should keep in mind after hair transplantation. See, after hair transplantation, the first thing that we do is we tell the patient to use, saline sprays, which have got some antibiotic like amikacin every 2 hours for next 3 to 4 days. Now what this will do is, this saline sprays, what it will do is, it will prevent the scab from collecting there. And when the scab collection is prevented there, the looks that we get, we prevent the infection and irritation that is happening and we improve the results. So saline sprays every 2 hourly post hair transplant is very, very important. That is one thing. Second, what has to be done is, after 3 days after transplant, we call you for a hair wash. And this hair wash has to be done very gently that the grafts are not lost. And this hair wash will prevent the formation of scabs and remove the scabs. The scabs are the blood clots that form and then increase inflammation and increase the chance of infection. So we do the hair wash on 3rd day and 10th day to decrease the formation of the scabs. You have to be very careful with the grafts for the first 10 or 15 days, not to scratch them on any pretext or put any pressure on them or friction on them. Otherwise, you can lose them. So you have to sleep very carefully, not scratch your hair, not rub your scalp against anything, and you should not be wearing any clothes which have to be taken overhead like sweaters and cardigans. You have to use jackets and shirts which open by the buttons or the zip, and they do not accidentally cause a hair loss or graft loss. Scratching has to be avoided on the scalp. It's very common to have a lot of irritation on the scalp, so it's always good to add some antihistaminics like cetirizine, montelukast to prevent this itching and so that you can avoid scratching on the scalp. You should not be wearing any tight-fitting caps for the first 15 days, but after 3 weeks you can start wearing them. Similarly, helmets should be avoided for the first 3 weeks after the hair transplant. You can start using helmet after 3 weeks. For the going back to your normal routine, normally we say you can start after 3rd, 4th day. You can have some swelling around the eyes and the face on between 3rd and 5th day. So be prepared that socially you do not keep anything very important for the first 1 week after hair transplant. And if the swelling develops, you have adequate time for it to recover. Usually swelling comes on the 3rd day and recovers by the 5th day. So keep that adequate time with you and do not keep any social and important engagements on the first week after the hair transplant. Routine work can be started on the 3rd day after hair transplantation, but public engagements should be delayed for at least 1 week's time. And regarding starting your gym activities and regular outdoor sports, we advise to start them on 3rd week onward, and you can use your helmets also after 3rd week onward. So these are the common things that you have to keep in mind. Post-transplant, after 1 week, we start with medications like minoxidil, DHT blockers, proper shampoos, and also some supplements which are good nutritional support to improve the results in the long run. These medications have to be taken for a long period of time because if you stop them, the results do not maintain. So keep using minoxidil and DHT blockers for a long period if you want the results to be maintained, because the results are not permanent with these medicines. So these are the few things that we keep in mind regarding medications. Another thing is like any inflammation like dandruff or dermatitis can cause increase in the hair loss. If dandruff is there, even before transplant, you must use anti-dandruff shampoos containing ketoconazole, clenbuterol and other medications so that you do not lose your hair. If there is dermatitis or infection, you have to use anti-inflammatory lotions so that the inflammation can be reduced. So these are things that you have to keep in mind. You have to be careful, when you are undergoing a hair transplant. Now, we have talked about the medicines that you have to take post-transplant and the precautions that you have to take. One important thing is lifestyle is equally very important. Smoking is something which causes very severe hair fall and hair loss. So avoid smoking, avoid stress and have adequate sleep. For reducing stress, you can do yoga, meditation, and there are other things that can help you to relax. So what I can help you to deeply relax is something that will be good for your hair. Having adequate sleep, proper sleep is going to promote your hair growth. So these are few things you have to keep in your mind when you are taking care of your hair. A diet which is rich in proteins is very good for hair because hair is made up of proteins, especially the cysteine protein, which is especially eggs and egg yolks, is something you can add on to your diet if you want good results in the long run. Then in our protocol, we always add PRPs, that is platelet-rich plasma therapy, and low-light laser therapy post-transplant to improve the results in the transplantation. We give 3 sessions of platelet-rich plasma therapy and few sessions of triple LT light also to improve the results. And the PRP not only improves the hair density, it decreases the hair loss and improves the result that we are getting in the transplanted area. And it is good to keep taking the sessions of PRP annually or maybe at a periodic interval so that the hair loss can be prevented and the hair can be maintained in a good shape for a long period of time. So these are few things we have to keep in mind when we are taking care of hair post transplantation. So thank you friends. With this I end my talk. I am Dr. Sandeep Bhasin from Carewell Medical Center. Thank you.